Hi, I'm Amanda Olson, and I'm a doctor of physical therapy and a certified pelvic floor rehabilitation specialist. And today I'm going to talk about how to use trigger point wands for treatment of issues that require using the wand rectally. So we're looking at a female model here, recognizing that both men and women and people of all different gender identities can have tailbone pain, pelvic floor pain that is very deep, and injuries to the pelvic floor muscles that require addressing them. So again, we're looking at a female model here, but this lesson will be applicable to both men and women. So what we're looking at here is the front of the pelvis and the back of the pelvis here. The pelvic floor muscles in both men and women begin at the pubic bone here, and then they span outward to the ischial tuberosities where you sit, and then reconnect again back here on the coccyx or the tailbone. So there's a superficial layer here and a deep layer inside that we'll talk more about in a minute. So in women, the urethra, the vagina, and the rectum pass through these pelvic floor muscles, and in men, the urethra and the rectum pass through the pelvic floor muscles. So if you've had a surgery, whether you're a male and you've had some sort of procedure in the pelvic region, or a female, there may be scar tissue in the pelvis. If you've had a fall where you've fallen down on your bottom and you've subluxed or dislocated your coccyx, or otherwise just injured the area, that can result in tailbone pain or more posterior pelvic floor pain towards the back. Also just different habits in life, riding a bicycle, so cyclists, people that sit at their desks for prolonged periods, or people that just subconsciously hold tension in the pelvic floor muscles can have pain in the pelvic floor musculature, often in the deep layer here, that is very, very hard to reach externally. So by using methods around the gluteal muscles, these trigger points can be located very deep and very close to the coccyx back here. So the wand that I created was specifically designed to be able to be used vaginally or rectally in females, or rectally in males, to address trigger points in the pelvic floor muscles. Two different wand types here. The purple one is the original, and it is, just as you see, two different ends here with some curvature that's designed to help you reach the deeper and superficial layers of the pelvic floor. The turquoise wand vibrates. So it has 10 different speeds of vibration on it that allows for increased blood flow and relaxation of the pelvic floor muscles. So you can see that the dimensions on the wand here are a little bit pointy and thicker on this end and a little bit more slim on this end. For most people, this slender flat end is going to be the most comfortable for rectal use. So you can see the diameter is smaller, it's got a little bit of more of a flat edge, and also when thinking about the anatomy of the pelvic floor, it's meant to come in to this rectum and come in and be able to hook to the sides, or specifically in men that are having pain under the pubic bone here or closer to the prostate area around the penis. It's designed to be able to come in and hook and come forward. So if you can imagine this end coming into the rectum, plenty of lubrication here. You can bring it in like this, and then I'm going to switch views here. Then the wand is going to come in, and you can locate trigger points in the obturator internus here, or in the deeper layer of the levator ani on either side. You can also come forward, so this angle here, entering through the rectum and coming forward and hooking to come closer up into that muscular area right under the pubic bone. I always recommend seeing a pelvic physical therapist who can help guide you in trigger point release. If you're a male, just ensure that you see someone that's comfortable treating males and has a good working knowledge of male anatomy, because some of the trigger points in the pelvic floor are just located in different areas due to different anatomy. When releasing trigger points, I always recommend that you never push any harder than you would push to check a tomato for ripeness. So if you're at the grocery store and you're checking a tomato for ripeness and you're pressing on it, you're gonna come in gently and check to see if it's ripe, but you're not gonna come in and squish it. You're not gonna come in hard. And we wanna respect the musculature, the fascia, the nerves, all of those very sensitive structures in the pelvic floor. So when we come in, this is how we release a trigger point. No more and less if it's very, very painful. So you're gonna hold pressure for about 1 to 2 minutes. What I recommend is when you locate the trigger point and you're holding your pressure, move your leg. You can bring in your knee up towards your chest. You can rotate the knee out to the side, but find a position when you're holding that trigger point where the pain decreases significantly, if not goes away. There's a certain position in each of the muscles that when they shorten, the pain just shuts down. So you still want to hold that pressure for about 1 to 2 minutes, but ideally you're in that significantly decreased or pain gone position during the trigger point release before you move on to the next one. You can use your wand daily, multiple times a day as needed to address your pain. And then just be sure to be getting a little bit of body movement during the day afterwards, 5-minute walk, just to get blood flowing and help the muscles continue to relax. If you have any other questions, please don't hesitate to email us at support@intimaterose.com.